healthcare practice in the US pushes operational heads to be business managers, financial wizards, and patient champions. From navigating insurance labyrinths to tackling staffing gaps, we solve everyday hurdles in both patient care and revenue cycle management. Hello and welcome to the Efficient Care Podcast, a one-of-a-kind podcast series that brings you conversations with healthcare practice leaders and innovators where we deep dive into their journeys and business learnings over the years. I'm Shruti Mehrotra, Head of Marketing at Aarogram. Welcome back to another episode in this fantastic series. Today's episode is a special one which opens an important conversation for healthcare providers. When it comes to patient financial clearance, how do we get provider technology partnerships right? Joining me for this conversation are two amazing guests. Michael Ball, Mike, Vice President of Clinical Services at Neurology Consultants of Dallas, also referred here as NCD, and Kashyap Purani, my colleague and founder at Aarogram, where we specialize in AI-powered patient price transparency and insurance verification automation. We are proud to have Mike's organization NCD as one of Aarogram's customers. This is part 2 of a two-parter episode where the three of us are in a conversation about Mike's strategies for improving operational efficiency and staff productivity by leveraging technology. In this episode, we deep dive into the importance of price transparency for modern healthcare practices, tips on tackling staff shortages, and Mike's golden advice on managing a practice like a pro. Enjoy.
Surprising, some of these practices are running paycheck to paycheck, right? And that's where the suggestion you made, partnering with can be a way among other ways, right? And you mentioned about the cash price as well. So I think that's a really good segue to the last main thing that I would like to focus on. We are so much focused on, as a company, Aarogram, so much focused on patient price transparency and patient, estimate side as well. Because, my observation is that when you talk about RCM or revenue cycle management, getting paid by the insurance side is one thing, but then there is the other side, which is the patient payment side, and that is also part of the equation, and that's becoming more important these days for two reasons. I would say one is high deductible plans, and then we've been hearing from other providers that patients have expectations these days. They want to know what's going to be their out-of-pocket estimate upfront. And whether you collect upfront from the patient or not, that could vary practice to practice, but they do want to know, at least get some idea what they're getting into. And so are you also experiencing that way? Or do you also have patients asking for upfront pricing? And how do you manage and communicate those scenarios?
We do. It's interesting. There's so many ways to pay for healthcare now, and there from the whole spectrum. There's people that just have 100% cash. They don't have any insurance coverage. They don't want to do that or can do that. And then you have the other spectrum, which is 100% Medicare with a supplemental, and it's just covered, and anything in between. Our patients have those expectations of what am I getting into, especially when you got high dollar tests like an MRI or an epilepsy test or rehab, series of rehab appointments following a stroke. The approach that we've taken is transparency. We really want to give the patient the most accurate estimate we can give them. And whether that's a cash estimate after they ask for it, or whether that's an accurate understanding of where their pay or where their insurance, what it would pay given the very moment that we're at right now. Technology can give us that. It's a matter of how can we put it into the patient's hands. And so what we've done is we've taken this approach of we would love to give our patients a tool that's available on our website or available somewhere that they can access easily. It gives them the ability to run their own benefits with our tools or our vendors. That tool gives them transparency then to go to their payer and say, ask the questions that they typically ask of us. Why does it cost so much? Well, it's because your payer and your deductible, and there's a series of reasons. Giving them the information they need to go to their payer also helps the payer, because then they can talk through the differences of why their plan does certain things. better information to the patient equals better understanding of what they're going to pay or what they have to pay or what their responsibility is. And then it also leads to better planning. So maybe they don't plan that test this month, or maybe they wait until the end of the year when their deductible's been met, because they know after a certain period of time their deductible will be met. So let's wait until the end of the year to do our high dollar tests. In my opinion, gives them so much more information and such a better understanding of how healthcare works. The other thing to think about that we're playing with these concepts is those that do cash pay or those that want these concierge type services. How do we bundle tests together for their benefit? How do we offer multiple services so that they can benefit on some of those discounts? A lot of our patients will come in and they'll get a new patient appointment evaluation, but part of that includes an EEG test, or part of that will include an MRI. Some of our direct contract discussions are centered around that, where if somebody has a neurological issue, when they come in, meeting with a doctor doesn't really give you anything because they need to do testing to understand better. So direct contracting with some of these groups to say if there's a neurological patient and needs a new evaluation, it's going to include an MRI, and it's also going to include labs, and it's going to include potentially EMG testing or EEG testing or a sleep test. Then it's covered and it's paid for, and the patient doesn't have to go to 5 different places, and the patient doesn't have to be responsible for 5 different bills that come in from 5 different doctors that interpret those tests. That, in our opinion, improves healthcare, and it also improves patient experience. So our goal and our focus now is to, like I said, to reiterate, we're making it more transparent for them to get their information based on their circumstance, their insurance policies. Then giving them the ability to bundle or do these things in a different way, meaning they can save as they do more here, because we know they're going to have to go get those tests somewhere. We know part of what they want to know requires diagnostic testing. So we're going to try to offer that up front so that they understand, okay, I'm not going to get an answer that first appointment. It's probably going to take the second or third appointment after I get all these tests before I get an answer to what my real question is. And that helps us with revenue cycle. It helps us with managing and projecting out our revenues and our accounts payable. And so thinking outside the box is kind of what we have to do to manage how healthcare is in our society today.
Prior auth teams play a critical role in ensuring smooth patient intake and reducing payment risks. Can you share some practical tips you've used to empower your team at Neurology Consultants of Dallas to overcome common roadblocks and streamline these processes? And can you share some battle-tested tactics you've implemented to navigate the prior auth maze and secure approvals?
Or what would be your wish list when it comes to verification prior auth scenario when there is no limit to what we can do?
Yeah.
What would be that in ideal world?
In my opinion, technology has a lot of good resources when it comes to prior authorization support. So there are some groups that you can completely farm it out and get it done outside of your practice. However, that's a risk, because at the end of the day, you can deny coverage for a service at any point for any reason, and you're risking letting another group do that for you unless they're sharing in the liability of that. In my experience, prior authorization is different for every type of test you do. Some of it's very easy and some of it's very vanilla, and we could do it with one person that has limited experience. When you start to get more into the high-end testing, like infusion and rheumatoid therapy, and you start to do some of these things with even some MRI, all of that, EEG, sleep testing, authorization is tough because you got to go through that payer's information, and it takes time, and there could be peer-to-peer requirements for this, or there could be hurdles that you don't anticipate. And so using technology to kind of cross off the easy things, in my opinion, is our way of approaching this. We have quite a few tests. Let's use technology to its fullest to meet the demands of those prior auths. Once we utilize the technology, how do we dive deeper and further? Training AI to do those things, we anticipate will make it a lot easier. So once you do several sleep tests or several infusions, and it's the same payer and it's the same type of drug, you start to understand the needs of that authorization. How we can utilize that for our benefit is what we're trying to do now, to be honest. We don't want to have to rely on one person who knows everything about authorizations. And I know that that's probably what every practice has, is one person that's worked with them for, a number of years, and they know everything about auths. And so that person inevitably gets burnt out. Our dream scenario is we have solutions and systems that can help us with these scenarios. And we continue to have these one or two people, but those one or two people can transfer their knowledge into some of these technologies for the betterment of the practice. And then they don't have to get burnt out. Then they're not on the phone 7 days a week to answer questions, to try to sort out denials. They're the ones training the AI or training the technology, and they're definitely needed. They're definitely valuable. But once that technology is there, using it correctly and disseminating that information out is our hope.
Lovely advice. At Aarogram, we believe that being efficient in your businesses as a healthcare provider also means providing more patient-centric care. Therefore, we ask this question to every guest on our pod. Can you please share a learning or an aha moment you've experienced in managing a neurology or healthcare practice that would be valuable for our listeners? And staff, practice managers, all of them included.
Yeah, it could be something, very clever or witty or something funny as well, That's a pretty out of the box solution that you have tried and
I
implemented.
got one for you, and this isn't my solution. It's actually one that I read about. It caught me off guard when I heard it. You'll become a good administrator or practice manager when you start to put patients second. Now that's a weird thing to think about. Why would you put patients second, right? So I read a book a while ago that's called Patients Come Second, and it's written by an administrator that ran a hospital. His name's Britt Barrett. And the book was about how do you treat your staff and how do you treat those that support the hospital. And if you do that correctly, patients will, as a result, become the most prioritized. They will get the benefits of how you run your hospital. Because when you have staff turnover, when you have a culture that's not positive, when you have problems within your organization, patients feel the result of that, right? It's not staff, it's patients. They're the ones that see the problems with untrained staff. They're the ones that feel the challenges when you don't have authorization support that you need. They're the ones that feel the difficulty in not being able to answer the phone to get their medication. And all of that is a result of not fostering a culture that's supportive to the people that run the practice or the people that work in the organization. And so his premise was, if you treat your people right, the good downstream effects will transfer to patients. And that's why patients come second, because you treat your staff right, you treat people right, and they become more willing to help, more supportive to patients. And the organization as a whole can give patients a much better experience when it's well run and it has a great culture and it has a great, it just has a great environment for growth and development. So my aha moment has always been, the best thing I could do for my patients is to make it better for my staff, because they're the ones that are here for patients. Every doctor that I've met wants to be a good doctor for their patient. They have personal, stories that tell you why they want to be a clinician. This is a passion for them. So if I can make their job better, if I can make their job easier, I know they're going to do that to the patient. If I make their job harder, if I don't give them the resources they need, the patient suffers. Yeah, they're not happy, but the patient will suffer. So that's kind of my aha moment. That's a weird one, but If I were to put a term on it, it's just patients come second.
That's very interesting and a little bit as well as you think about it. But
In my mind, though, yeah, you're a hero, Michael, for doing this, for recognizing where you fit into the whole system. It's lovely.
it's a great takeaway for our audience as well. If you take this away from listening to this podcast, and I think it's especially important in this time when we are dealing with staffing crisis in the U.S. healthcare.
That's tough because there's a lot of staffing turnover is huge, and especially was during the COVID, the COVID dilemma. And so burning out staff, I see it every day. A person that comes to work in a hospital or in a healthcare system, they're coming because they like being there and they like helping. Something in their DNA means they want to be a helpful person naturally. But when you make it hard for them to be what they naturally want to be, it burns them out faster for some reason. Like they become more disenfranchised to do what they naturally would do when it's harder to do it or it's difficult. So they're not going to point towards their job to do those things. They're going to go home and do more of it to neighbors, or they're going to be more helpful to others elsewhere because they're not being able to do it at their job. I want to make the job the place they want to do that the most, so that when they come to work, they want to get out what they naturally want to by helping there. And they feel fulfilled at the end of the day. They feel great because I was able to do what that patient expected of me because I had the resources to do it. I had the team that helped me do it. And that patient left with some answers. That family, left with some support for their patient. The more I can help do that, I feel fulfilled. And so it's kind of it's a positive loop all around.
Wow, what a team player, Michael. It was lovely to have you on the podcast. Thank you for taking out time for us. It was lovely to meet you and to speak with you.
Great. Thanks, guys. Appreciate it.
Thank you, Mike.
Thanks for listening to our podcast today. If you enjoyed this episode, be sure to subscribe to our podcast and leave us a review on your favorite platform. And if you have any questions or comments about today's episode, we'd love to hear from you. You can find Aarogram's LinkedIn and website address in the description box. Thanks again for tuning in.